साल और एक बार फिर से आ गया हूँ मैं आप लोगों के बीच, आपका अपना RJ Abhinav 90.4 मेगाहर्ट्ज कम्युनिटी रेडियो ज्ञानवाणी यानी कि ज्ञान की वाणी पर दोबारा से आप लोगों का फेवरेट शो लेकर आया हूँ, जो कि है नो योर फैकल्टी। जैसा कि आप जानते हैं कि हम हर बार एक स्कूल से, एक डिपार्टमेंट से एक फैकल्टी को, किसी एक टीचर को, प्रोफेसर को आप लोगों के पास लेकर आते हैं, उनसे कुछ सवालात करते हैं, उनके बारे में वो बातें जानते हैं जो बातें आप लोगों को नहीं पता और हम लोगों को भी पहले से पता नहीं होती हैं। आज एक और ऐसी ही शख्सियत हैं हम लोगों के बीच, जो कि हैं स्कूल ऑफ पब्लिक हेल्थ से। उनके बारे में मैं आपको इंट्रोडक्शन दूंगा और उनका फॉर्म वेलकम करूंगा और उसके बाद उनसे हम करेंगे चंद सवालात। सबसे पहले मैं उनके बारे में आपको बताता हूँ, जिनका नाम है डॉक्टर सिराजुल सहरिया। As a public health professional with a background in community medicine and epidemiology, Dr. Sirazul has worked in community-based projects since the last 20 years. Among several influential projects, he has led the planning and implementation of the Mumbai Maternal Nutrition Project, MMNP, a food-based randomized controlled trial, RCT, that involved over 6,500 women in 61 centers of slums, almost population of 1,65,000 of Mumbai. He has liaised with stakeholders in the community, regulatory authorities and government agencies during these projects. Following his exceptional work, he received a fellowship to pursue MSc in Epidemiology from the London School of Hygiene and Tropical Medicine, LSHTM. His ability to form a strong association with like-minded researchers and program leaders from across India and the world have enabled him to create meaningful collaboration with experts from areas like Mysore, Dervan, Vellore, Hyderabad, New Delhi, as well as UK, South Africa, Ethiopia, the Gambia and Ivory Coast. His leadership skills, academic training, and experience in teaching, planning, implementation, and monitoring of community-based projects, both research and implementation, including financial management in areas of nutrition, maternal and child health, adolescent health, tobacco control, palliative care, and non-communicable diseases (NCDs), with multiple stakeholders, partners, and funders, make him an integral asset to the DYPU School of Public Health. Sir, very warm welcome here. Good morning. कैसे हैं सर आप?
Thank you. Good morning.
जी सर, सबसे पहले सवालों का एक सिलसिला, उसी से शुरुआत करता हूँ. Tell us about your journey here at DY Patil University. When did you start working here, and how have you evolved as a teacher and human being?
Well, I joined last year on 29th of July 2023 as an associate professor in the School of Public Health. Previous to that was mostly on working in communities, working on research related to nutrition and non-communicable diseases. This opportunity has sort of favored me in a way that and now whatever I have learned in last 20 odd years are teaching to the students of public health right now. So it's a very interesting journey altogether.
Oh, sure, sir, sure, definitely. What made you choose the field of public health? How did you prepare yourself for this since school and college days?
Well, it goes back to my training in MBBS. As a MBBS students, we have been taught about how to treat a disease, and also talks about how disease spreads basically. But while if a person suffers from certain disease, no doctors are interested in talking about how this person has suffered. So it was mostly focused on treating the person at that point of time, and often these people come back as the same, suffering from the same sort of disease or illness after a couple of months or a years together, because they don't know how to prevent those. And these measures in public health are actually very simple. Only thing is that we don't tell them at the right point probably. So that fascinates me, that I could prevent so many different diseases by just advising people rather than doing not doing much, you can say. Yeah. It's a very powerful tool. Just telling the people that how to prevent a disease, and you can prevent those actually.
Oh yes.
In real terms.
Dr. Rj Patil sir is an inspiration for all of us. How has he motivated you?
Well, as I joined, I could see his very strong leadership in in all the areas, and he seems to be very fascinated uh, with uh, with education per se, and of course he is interested in sports and other things also.
Oh yes. Oh, yes.
But as a public health person, I could envisage that his way of thinking, especially for School of Public Health, the way he want to go ahead and in this, and his advice always comes handy for us. So yeah, definitely is a person to look for, and I'm sure he'll be guiding us in the future too.
Oh sure. Oh sure. Nicely explained, sir. Tell us something about, especially with the key challenges that public health professionals face in ensuring the well-being of communities.
Well, I think most the challenge right now is that where public health lies in the whole gamut of medicine and other common things. So it's always been taught that this is a medical stream.
Stream.
Actually, public health is not a medical stream. It's a combination of medicine, then sociology, psychology, environmental health. So it's a complete gamut of all the things, and you really need not to be a doctor actually to become a public health person.
Oh, true.
So right now, of course, after COVID, there hasn't been an importance of public health, and people started understanding that there is a need for public health personnel to be there in the community to help and guide the people in terms of, especially in terms of any epidemic and such. So yeah, that's an interesting field. I think India is evolving in that. So we are seeing more and more public health schools nowadays.
Okay. Yes, you're quite right about that, sir. Okay, with the recent global health crisis, अब कुछ सवाल आपकी फील्ड से लेता हूँ सर. How has the role of public health evolved and adapted to new challenges?
Well, there are two things into it. One is the new challenges that is coming up. The other one is re-emerging old challenges. Basically, we still struggle with tuberculosis, malaria, disease of malnutrition in all this. Again, the new challenges are coming up like epidemics like COVID and all.
Oh yes.
And also related to say obesity and non-communicable diseases also. So it's a two-sided sword that we could see. So we still have this communicable disease as well as non-communicable disease at the same point of time, with combination of nutritional disorders.
Okay. Environmental factors can significantly impact public health. Could you elaborate on how public health efforts work to create healthier environments?
Well, I think this is now the latest actually talk in the town.
Oh, yes.
Environment. And what is not being talked much about is that in looking into this environment per se in terms of how it affects health per se. We are looking at pollution in terms of reducing say or improving air quality or reducing noise in terms of, we are not focusing on how it affects the health of humans per se. So there is need to focus on connecting this environment and also linked it to health of the people together. And if you see that, we'll probably find a lot of answers to our current problems actually. So yeah, and with this now we are facing problems of say extreme weather conditions. They're having effect on our health.
Sure,
many of people will agree with every, I think, season we have got certain increased number of cases in either respiratory illness or illness related to GI tract happening every year, and it's increasing actually.
Also having the effect of global warming?
Yes, definitely. Global warming has played a part into it.
Okay. Mental health is gaining more attention as an essential aspect of overall well-being. How does public health contribute to mental health awareness and support?
Well, I think this is one of the most important thing currently. I think I think almost every one of us actually suffer from certain amount of mental issues
these days.
It's a very common thing, and of course it is least talked about also at the same point of time. So what public health does is basically take that into in a way that we can talk about it, and it's not a thing that we should avoid or we should not talk about. More we talk about it, people will come forward with their problems,
and they'll share your problem, their
problems,
discuss.
And mostly when you say mental health, is not really talking about psychiatric problems. We are talking about general health per se, which can be helped by having just a peer support group. So which doesn't need actually medical help. Most, I think 99% of mental health issues doesn't need any medical help. We just need support group. People need to understand what the problem is and help them, those who need at that point of the hour.
At that point of time, yes. Okay. What makes our institution unique? And of course, a faculty like you. But what about the factors such as the infrastructure, cafeteria, lab and research facilities, the varied courses, and the general environment of learning and fun?
Well, I think if I say that one of the reasons joining this institute probably is also the infrastructure. I must say so. When I came for an interview, I was very impressed with that infrastructure per se, because that is the first impression you see it, and I think it is at par with any international institutions. So I've visited many of them, and I'm sure they can. We are at that level right now, and of course other infrastructures like availability of sporting facilities, library services, then laboratory services are top notch, I think.
Oh sure, sir. Okay, if you would have not be a professor, you would be.
That's a difficult question to answer. Of course, if I'd not have been a professor, I'd still have been a researcher, I'll say. In the public health domain only, and probably being researcher is that you will be able to teach whatever you have learned till now. That's it.
Okay. What is the greatest lesson you got from your student?
Well, I know much less than them actually at times. Yeah. So I need to read more. Which I'm doing currently, because
updating yourself.
Yeah, when I do research, I know particular things very well about certain things, but I don't know many things about. So I think the student has taught me that okay, I need to go back, read more, come back with more things for them, so that I can guide them. Yeah, that's one thing I feel.
Okay. What do you do in your free time? How do you juggle your hobbies with your career?
Well, I don't have much hobbies right now, but yeah, whenever I time, obviously I like listening to music or catch up a movie or something like that. Well, I also feel that being at rest, at peace, is also equally important, which I do most of the time nowadays. So just leave it everything aside and just.
So you love your sleep?
Yeah, I also love my sleep, definitely.
Okay, nicely explained, sir. Okay, what are the career opportunities for students of public health?
Oh, huge actually, huge. This is sort of an emerging field, and if you look at the government per se, the government has coming up with public. Looking for public health personnel in different districts and taluka level. Of course, in international level, there have always been there the WHO, UNICEF, the UN organizations, all multi-sectoral organizations do employ public health personnel, and also the organizations that work on health or on areas of nutrition and all, always need a public health person to support their sort of work.
Okay. तो ये थे सर कुछ सवाल आपकी फील्ड से, और हम जाते हैं अपने नेक्स्ट राउंड की तरफ. वी आर मूविंग ऑन ऑन द रैपिड फायर राउंड, सो आई थिंक यू आर रेडी फॉर दैट.
Yes, I'm ready.
Okay. Best advice you got in your career?
Keep learning, that's all.
Keep learning, yes. The happiest moment of your life?
When my daughter was born.
Okay. The saddest moment of your life?
When I lost my elder brother.
Okay, sorry for that, sir. Challenging moment of your life?
Well, challenges are actually daily affair actually.
Every day is a challenge.
Yeah, every day is a challenge.
Especially with the
yeah.
students.
No.
Okay. Which actor is your favorite?
Which actor is it? It's again a very difficult question to answer because probably as I watch different movies, I fall in love with different people altogether.
Okay.
For a couple of days, it stays. Again, a new movie comes. I fall in love with a new
Okay.
person.
So it depends on person to person,
Yes.
or the movies to movies?
Yeah, movies. It's more of a movie centric rather than a person centric.
Mhm. Okay. Okay. Your favorite book?
I still probably not currently something that I have wrote. I think I'm more fascinated with the stories that I learned during my early childhood. So this sort of stories still attract me. So I can still go and read them. So that's what I do sometimes.
Oh,
So
okay. Nice, lovely. Okay. Sir, favorite food?
I'm basically from Assam, so I
Oh.
also I like my Assamese
Mountains
dish.
food.
Yeah, Assamese dish.
I've been into Assam, especially the Guwahati and Manipur.
Yeah.
When I
Okay.
was on my educational tour.
Mm.
It's lovely, natural beauty. Okay. Your favorite movie? Or it depends के जब आप
Yeah,
कुछ अच्छी
I
लगे.
can't say there is a favorite movie altogether actually. I'm a
Okay. So it was a rapid fire round, and you have given us the answer very well, sir. Insights of your life, and idea that changed your life.
well. After my masters in Guwahati, I decided to move to Delhi, and I met a professor in All India Institute of Medical Sciences, New Delhi, who asked me, with looking at a report that my predecessors had, do a sort of a PowerPoint presentation.
Oh, okay.
So I was naive. I didn't have an idea about actually computers that point of time, and so instead of saying no, I couldn't do it, I just tried doing it. So I took help from my friends and people who were there, and I went back after a couple of days to show it to him, and his first word was, "Have you done this for first time?" And I said, "Yes." I didn't know, so I asked some people, and they helped me, and this is my first presentation. He took paint in a way that he asked me to sit beside him and taught me everything about PowerPoint presentation at that point of time. And at the end of the day, he said that, see, I have spent about an hour and so with you just because you tried. It's not important for me, you didn't make a perfect one, that doesn't matter.
Oh, yes.
But because you tried, so I'm helping you in that sense. Otherwise, I don't teach all these things to anybody.
Oh, yes.
So that taught me that let us not say no to anything. Let's try it out. If it doesn't work, that's fine. But it might work if you have a good guide actually.
Change the will to going forward.
Yeah.
Especially, sir, I want to assure you, sir, that please don't mind. ऐसा कोई परेशानी वाली बात नहीं. Especially, I am also at the same page with you. Especially on the same page. कि मैं भी जब यहाँ पर आया तो मुझे PowerPoint presentation I didn't know about that.
Yeah.
But yes, I learned it very well because nowadays you know about that we are making posters on Canva. So Canva is also making the PPT at the same time. I learned it there, especially. So suddenly it came to me just like that. Okay. So अब एक और question, sir. How success has changed you? Do you think you are term as successful?
No, I don't think I'm a successful person. I don't consider myself to be a successful because I think in our field that a lot of people who are much ahead who has done extremely good work in terms of their work. So I'm nowhere close to actually anybody right now. So,
but you're satisfied?
So yeah, I'm quite satisfied with the way it took up, and I'm happy. I'm happy to continue at that space also. That's also fine. So, as you talked about mental health, I'm happy to be more at peace with my work also, rather than running around.
Oh, lovely, sir. Lovely. Okay. The best role of your life: father, husband, son, or teacher?
Father.
Okay, father. Husband का मतलब सबको पता ही होता है.
पता है.
उसमें कुछ फर्क होने वाला है नहीं. वो ठीक है. जैसा चल रहा है उसको आपने मान लिया होता है. Okay. Any message you want to convey to anyone, and then we will go to the this or that round. Okay.
No, nothing specific per se, but if some student is listening to it, I think it's more of they should be more open or receptive to the advice that is given by anyone who is senior to them, because all this advice comes with, most of the time comes with an experience rather than or with a degree. Not really people advise you on degree, but more with their experiences they come through. So it could be an easy way to understand the life difficulties with just an advice from any senior probably.
Okay, great. So now we are moving on this or that round. I'm giving you the options. Okay, veg or non-veg?
Non-veg.
Okay, gym or yoga?
None.
Okay, none. You are only taking the work
Yeah.
according to you. Okay, early riser or night owl?
Early rise.
Early riser. Emotional or practical?
Emotional.
Okay. Books or Kindle?
Books.
Okay. Mountains or beaches? You are the mountain guy.
No, I'm a beach guy actually,
Oh, okay.
because I prefer beach. I think again the same. The effort you need to reach to a mountain is much this one, and and you can go to a beach, just lay around, enjoy the sun.
Oh yes.
That makes me more happy.
You are right about that, sir. Actually, क्योंकि मेरे साथ एक ही चीज हुई थी. And first when actually I went to गुवाहाटी, तो सब कुछ तो ठीक है, वो मुझे बस या कार ऐसे इस तरह सड़कों पर जाती है, तब मुझे पहली बार, अमूमन मतलब मेरे साथ बिल्कुल नहीं होता कि मुझे वॉमिटिंग हो गाड़ी में, अमूमन नहीं होता, बिल्कुल नहीं होता. तो पहली बार मुझे ऐसा फील हुआ कि इतनी ज्यादा घूम रही है, इतना zigzag हो रही है कि अब मुझे लगता है कि वॉमिटिंग हो सकती है.
Yeah, I think you enjoy even the way to your beach also is enjoyable, which is not for the mountains.
So enjoy is actually different. Okay. Religious or spiritual?
I'll call it spiritual.
Okay. Amazon Prime or Netflix?
Amazon Prime.
Okay. So, I mean, any series now you are watching or you're liking nowadays?
The difference in approaching OTT is that I don't go when it's released. No, people wait for it. I don't go by that. So whenever I have time, I see that okay, can I have this couple of series together or something like that. So then only I plan it. So even if some new series comes up, which is say like Mirzapur or something that comes up often, so I'm not a person who is waiting for it.
I'll binge watch. जब मुझे वक्त मिलेगा मैं देखूँगा.
Wherever time will come, I watch that. That's what I do most of the time.
Okay, great sir. यहाँ पर आज मेरी बात हुई थी डॉक्टर सिराज सर से, जिन्होंने हमें काफ़ी ज़्यादा अच्छी बातें बताई और स्पेशली अपने बारे में और भी बहुत सारी बातें बताई, और हम ज़रूर चाहेंगे कि वो हमारे साथ नो योर डिपार्टमेंट में भी ज़रूर हम लोगों से अगली बार मुलाकात करें. तब तक के लिए बने रहिए हम लोगों के साथ 90.4 मेगाहर्ट्ज़ कम्युनिटी रेडियो न्यानवाड़ी पर. थैंक यू सो मच सर.
Thank you.